to Speak Our Minds, the fight for youth mental health, the podcast that delves into the inspiring journey of youth mental health advocates who took a stand and transformed a system. Together with your host, Heidi Baskfield, we'll explore the landmark lawsuit that held the state of Colorado accountable for failing to provide essential youth mental health services and won. In each episode, we'll unpack the intricate details of the lawsuit, guiding you through the legal battles and the monumental settlement that set the foundation for a working system of mental health. We'll examine the steps Colorado is now taking to build a comprehensive and effective mental health care system for its youth, highlighting both the challenges and the triumphs along the way. Join us as we learn from experts in other states who have successfully navigated similar crises, offering invaluable insights and strategies. Hear firsthand accounts from parents, providers, and professionals who are deeply committed to ending Colorado's youth mental health crisis. Their stories and perspectives will shed light on the impact of the lawsuit and the hopeful path forward. Whether you're a concerned parent, a mental health professional, or an advocate for change, this podcast is your guide to understanding the profound transformation taking place in Colorado's youth mental health landscape. Welcome to Speak Our Minds, the fight for youth mental health. Let's embark on this journey together.
So today I am so excited to welcome two guests to Speak Our Minds. First is Elliot, Community Engagement Specialist in Youth Outreach, and Quatisha Bailey, who is also known as Q and is here as the Executive Director for independent health and wellness consulting firm and Q's with Q. Welcome, Tiandis and Q. We're so happy to have you with us today.
Thanks, Heidi. We're excited to be here.
So the two of you are the first guests who work with youth on a daily basis in such a way that we're going to get to have a really fun conversation in talking about what you're seeing, what these kids are expressing that they need, what you're observing, and how this system work that we're doing here in Colorado can be built to be responsive to what you're seeing. So I want to start off, and I'm going to start with you, Tiandis, and have you give a quick description of your work and how it is that your work is supporting youth mental health. And then we'll go to Q after that.
Yeah, so a description of my work, which is like pretty much summed up. I work in community programming and secondary violence, which I intervene specifically in Denver and Aurora, Colorado, pulling youth who don't really have an outlook, who fell down, who feels like they don't have a support system. I kind of build programs for them that tailors to giving them just a brighter outlook on life. And I'm a big, huge mental health advocate that goes into that space. So every time I'm organizing a program or out here hitting the ground running with DPS as a restorative coordinator, I always put youth mental health first and just trying to get them the help that they need.
That's fantastic. Thanks, Tiandis. Q, your turn. Talk to us about your work.
Yes, and thank you for having me here. I am so excited to be a part of the work that you are doing for our community. Heidi, like you said, I am the founding executive director of Questions with Q, or Q's with Q, which is an independent health promotion and wellness consulting business designed to strengthen young people and adults throughout the state of Colorado. I am just so passionate to work with youth, educating the underserved and marginalized vulnerable populations. My experience working with youth throughout my whole 15 years has in the public health field and on primary prevention initiatives, including mental health, drug and alcohol abuse, sexual health, and sexual assault prevention work. I also have created, I'm so sorry.
No, please.
I've also created an anonymous text line that is really geared for youth to be able to ask any question that they may have. And I also provide them with resources that they need.
So The work each of you does on a daily basis is phenomenal. And I have to say, I've been able to be able to see both of you in action, and we'll make sure that all of your contact information is available for those who are going to absolutely want to work with you after they hear what you have to say and hear even more about what you're doing. So I strongly encourage anyone listening who's interested in this kind of work, get in touch with Q and Tiandis. They do incredible things. With that, I want each of you, and Q, let's start with you. What are some of the most common struggles that you are seeing when it comes to teens and mental health?
That's a great question. When I think about teens of color, they face several unique struggles that impact their mental health, many of which are rooted in systematic inequities and equalities and social pressures. One of the most common struggles in the experience of racial discrimination, both in their communities and within educational institutions. This can lead to feelings of isolation or anxiety and even depression. Most teens of color deal with the stress of navigating many different identities, such as being Black, or their sexualities, their identities at school versus who they are at home. And I think that another issue is the stigma around, or should I say, surrounding mental health in many communities of color. This stigma can prevent teens from seeking help when they need it, or being told that they don't need to talk to anyone about their feelings or emotions, or the need of easier access to mental health services.
Race absolutely plays a role and has a direct correlation to youth and communities of color having mental health issues. In an article published by the New York Times in 2022 entitled "Why Are More Black Kids Suicidal?", the article spent a lot of time delving into this topic specifically and reported that the suicide rate of Black youth ages 5 to 12 is 2 times higher than white youth of the same age. We can't look at the issue of youth mental health in communities of color and not simultaneously talk about the implications of racism. Q, that's all super helpful. To what degree are these youth aware or in touch with the fact that these very difficult emotions and mental health challenges that they're working to address have direct correlations to things like racism? Do you think there's a pretty high level of conscious connection between those two, or are we still trying to help them understand that that's part of their experience? Like, how would you describe that? What do you think they see?
To be honest, I don't think we ever talk about it. I think teens of color and teens in general are desensitized to things that are happening in the world.
Sure.
And I don't think that they make the connection of a mental health versus what they're seeing on social media or at their fingertips. For an example, the police brutality, the discrimination that we tend to see all over on an everyday basis. And when I mention desensitized, they're so used to it, they probably don't even connect that it has something to do with their mental health. But I know my personal thought is when I do see things as a Black woman, I do know that things that are happening in the world does affect my mental health. It changes my mood. Sometimes I have anxiety. Sometimes I feel like, wow, this is really heavy and it really affects me. But I don't know if teens recognize the connection between the two.
Sure. Tiandis, from your standpoint, sort of what would you share in what you're saying, or anything that you would add to that Q shared?
Yeah, so I would definitely have to second with Q, because when we talk about social pressure, I feel like the kids of color definitely have to uphold a certain look. You know, we're constantly we were told coming up, you know, me and Q, and I constantly tell my kids, which sucks, but I have to say, like, hey, look, like, we have to have a certain type of attitude. We're in a certain space. We have to handle situations this way. And I think us as parents or just as community advocates, that does play a lot into their trauma, into their mental health, and how they think that they're going to be perceived. So that's a huge issue. And they always say, you know, racism doesn't exist, but It definitely does. And I feel like when we're surrounding ourselves with that conversation about the social pressures, that's when it comes into play. When we talk about generational trauma, people always think like, oh, well, it's because grandma got whipped with a switch. Like, that's not what we're talking about. We're talking about how now the older adults are always saying like, y'all are always so sensitive. Kids are so sensitive these days. And it's like, they're not sensitive. We're just telling them like it's okay to express their emotions. And I think it has a lot to do with boys of color. I'm super huge in that because there's a lot of resources for females, and we do protect a lot of girls because as, time and time has been around, like females have been the one that have been brutally, we just been violated no matter the color of the person when it comes to that. Females have been violated. But then when we look at certain spaces, do we actually protect little boys of color as much as we do with the females of color? Because I also look at, there is so many young boys of color and older men who have been sexually abused that I feel like that plays a large, huge effect in the Black community when it comes to that. And when I look at our community, our music videos, our music, the way we handle ourselves. So kids are looking at that. Like, I'm even at fault of sometimes the music my boys listen to. They also deal with their own issues that they talk to me about personally, and some of the kids that I mentor. And I always say, like, it's our music. Like, who wants to wake up every day and just be like, I'm trapping it out. I'm about to sell drugs in my mind before I go to school or before I go to work. So it's a lot that plays into it. Like, anything that we see, we ingest. So rather, it doesn't have to be physically ingesting it. We're ingesting it into our mind, and it's stuck in our mind because our body doesn't know reality from not reality, when we're thinking about the subconscious of everything. So there's a whole lot that plays into the traumatization and the mental health that we're facing, and that especially the youth are facing now when it comes to like the mental health.
When Candace is talking about the intersection between sexual abuse and mental health, this issue is a very real and pressing one in communities of color. The CDC put out a report in 2022 stating that 1 in 5 young Black men has had some encounter with sexual violence. And the American scholar Dr. Tommy Curry, in his book, The Man Not, talks about this issue specifically, stating that sexual violence against Black men and boys has remained a routine and historically denied aspect of anti-Black racism. All that to say that we cannot combat the mental health crisis in communities of color, especially for young Black men, if we're not talking about what's happening with sexual violence and sexual abuse and coming up with new ways to remove the stigma and support these young victims. That's fascinating to hear you talk about it in that way. First, I would say so important to recognize that every time you change an environment, you're expected to adhere to a different set of rules of engagement. How would that not create anxiety? Because how are you supposed to keep that straight? And why should you have to do that? And so clearly that would be a compounding issue for already existing things that stress our kids out. And then you add these other dynamics that you're talking to. And I couldn't agree more. Also, as a boy mom, we don't focus enough time and energy on our boys, and we expect them to adapt in ways that we don't with our young women. And so, like you, I'm a passionate advocate for giving our boys and young men the tools they need to express their emotions. And goodness gracious, like, say things like, that scares me, God forbid, or I'm not sure how to deal with that, or the idea of being a tough guy is not who I am. So thank you both for sharing those things. I think they're super important messages. Q, when we take that into your space specifically, and I'll say, you work with this anonymous text line, which is, my God, the most valuable community resource to give that kind of safe space for kids to ask whatever questions they need and then get evidence-based information back, as opposed to talking to the friends who often feed them all kinds of nonsense. Thank God for you and the work you do in that. When you think about a lot of the stuff that you're getting through that text line, likely being around sort of risk-related behaviors, what do you want to share about that? How are you helping kids avoid those risky behaviors? And we don't talk enough about them as adults because it scares us, but what should we be talking more about? And how should a system be designed that is being more responsive to what these kids are asking you about?
When working with youth, it's evident that risky behaviors exist, such as substance abuse, unprotected sex, involvement in gangs and violence. They're all often symptoms of underlying mental health struggles. Many teens engage in these behaviors as a way to cope with stress, trauma, or the feelings of hopelessness. Me working with youth is I attempt to meet them where they are. A lot of times it's just kind of creating a safe and brave space and an environment for teens to be able to express themselves and really talk about how they feel. I can go into a classroom setting and facilitate a sexual and reproductive health presentation. I love to start with trivia questions and statistics to kind of see where they are. So then, and these educational dialogues are age appropriate depending on the classroom, the age group, etc. And I attempt to provide them with medically accurate information. When talking about the text line, I introduce them with the text line number because I know that I am giving them a ton of information in that 50 minutes of a classroom setting. And so I think because I build, that's one of my magic sauces that I like to say is building connections. And I tend to build connections with youth right away where they want to share. And sometimes they have questions that they may not want to ask in front of the class. So then that anonymous text line is there for them. There is a disclosure, you want to be at least 12 years old to be able to text the text line. But I've received questions about their sexuality. I've received questions about, I'm feeling overwhelmed. I feel like I'm in a state of mind that I really can't get out of. I think it's my anxiety or depression, and I'm linking them to behavioral health services or mental health services and making sure that the resources that I'm connecting youth to, that the trust is there and built, that I can actually send a text message to providers to be able to provide the services for youth. There's a ton of questions around the relationships between parents and youth.
Right.
There's so many questions around, I've had unprotected sex. What are my options? Or I think I may need to get tested for an STI, or what is an STI, a sexually transmitted infection. So just, again, having access to someone and being able to also ask the questions that you may not feel comfortable asking your teen. You can't talk to your doctor, or you can't really ask your friends because they may judge you, that you have a text line and access to 24/7, any question that you may have. And I do have a team of, I have a friend that is a part of the LGBT community that if I have questions or I need input, there was a question around a chest binder, and I reach out to my peeps. I also have my doctor friends or my provider friends that also can help navigate through that anonymous text line.
It's fantastic. It's fantastic. And when you say those things, I mean, I have a personal appreciation for the work that you do, because I'm super clear that when kids can be that open about what's going on and get a communication channel with a trusted adult and get good information, they are going to be better off as a result. Why do you think having these conversations, like, I'm a mom, I have 2 young children. Why do you think these conversations scare us so much as adults and parents to have?
Yes. And being a mom of 2, an adult teenage girl and also a young, almost 13-year-old. I have a almost 19-year-old and an almost 13-year-old. And their personalities are so different. I have my oldest one. I've had many conversations with her in teachable moments and situations, and making sure to meet her where she is. And I think having those relationships, right? Yes, at times conversations can be uncomfortable, and that's why it's important. And just a plug, I am creating a parent workshop where we have monthly meetups and just talk about uncomfortable conversations, and also providing tools for parents, and also allowing parents to give their thoughts and ideas on how they answered or how they deal with uncomfortable conversations. They're just uncomfortable, even when we're talking about substance abuse. when we're talking about sexual and reproductive health and what does that look like. I just want us as parents not to feel like naive, like they're not going to do it, because I want us to all think about when we were teens, what were we doing, right? And I try my best to equip my two daughters to live the best, healthiest lives that they can. And that's so important. But there's teachable moments in everything. First of all, you want to get them in the car where they can't leave. Yes. And you can start those conversations. But again, those continuous conversations that we just need to have. I have such a great relationship. I like to call myself Mama Bear and my cubs. I have great relationships with them that they can talk to me about it. Sometimes I have to take a step back and really think, not to respond so quickly, but just to listen, right?
Yeah. Yes.
And then ask questions opposed to trying to find solutions or what you need to do, right? And it's just when we don't have conversation about sexting and watching porn and all of those things that we just don't talk about, they have full access at their fingertips. We have no clue what they're watching. We have no clue what they're doing, but it's important that we have conversations, whether it makes us uncomfortable. If we don't know the answer to them, we can Google search and research it together. And so I think that those are all important tools. And again, we want our adolescents, our children, our youth, our young adults to be safe and live their best lives that they can, but in a healthy way.
For sure. And I will just say, personally speaking, that it was my learning from you, Q, that helped me talk to my own kids about their bodies and do that first drive through sexual education before they get it in the classroom. And I would have been really lost without your support. So sign me up for one of these parent meetups, because I can already tell I'm going to need it desperately. And we'll get the information out to people about it, because it will just be an incredible resource that people don't even maybe know they need until they're sitting in that room. And then they go, oh my God, I have no idea how I would deal with this. And I totally need to understand. So thank you for making that available.
And you help me remember that suicide prevention is so important in doing check-ins with our youth, because we never know what they're going through. If they're being bullied, if they're being harassed, we never know. And when you ask a question, I remember asking my youngest daughter, if you are on Snapchat and someone sends you an inappropriate photo of something that you didn't ask for, what do? And her response was, I'll just block them and delete them. That's not enough.
Right.
That is not enough.
Right. Like, and then what? Right. Exactly. No, that's such a good point. And Tiandis, because of all the work that you're doing in this space of community engagement, there are different things that you're seeing in communities of color. You've touched on some already, but talk more about what it means for youth living in the context of a community of color, and what it is about that sort of community experience that people need to understand as they're thinking about how to support the mental health needs of youth of color.
Yeah. So when I think about that, we have a certain culture, and I think, not saying our culture is right, but I'm also not saying that our culture is wrong, because there's a lot that goes into our culture that I love, I love as a Black person. And I think when we get into certain spaces, they're like, oh, don't act like that. Don't do that. We're taught and brought up to have imposter syndrome. So I think that plays a lot into our younger youth, because when I'm in the schools, there are a lot of young Black kids that I could automatically tell, there's a lot that goes on with them at home. Yeah. And automatically when a child enters grade school, they're seen as trouble when they're of color. That's off the bat. They can be getting in the same trouble as their classmate who is not of color. And, it's, oh, they just, are not listening. They're doing this or they're doing that. But then as their white counterpart, they're, oh, well, maybe they have ADHD. Let's test them for this. Maybe they're having that. Let's reach out to mom. Let's see what we can do. And kids recognize that, because there was a lot of kids that I work with and they're like, that's not fair. How come I got sent here and they didn't? Mm-hmm. And, it's always, and I'm always like, well, let me deal with that. And I kind of always want to be that person that's that safe space, because again, I want to be the advocate for you. Don't think that I'm going to let that slide right past. So as they're coming up, they're seeing those differences. So that starts to affect them mentally. Like, what is wrong with me? Is there something wrong with me mentally? Is there something wrong with me physically? Why are they treating me this way?
During the 2020-21 school year, the number of Black male students involved in disciplinary outcomes at school was disproportionately higher compared to their enrollment numbers in kindergarten through grade 12, according to a report by the U.S. Department of Education's Office of Civil Rights. Specifically, the data indicated that Black boys were nearly 2 times more likely than white boys to receive an out-of-school suspension or an expulsion. This disproportionate treatment of young Black boys when it comes to the application of school-based discipline does have a direct correlation to what we're seeing in mental health statistics and the increase in the number of young Black men dealing with issues of anxiety and depression.
And then, you look at the home life. Home life may be good, but it goes back to, are we actually listening to our kids? Because I'm going to be honest, like 70% of Black households, like we yell all the time. Like we're just like loud. And it's like we're on go like 24/7. And so it's like, dang, do I ever stop and listen? And with my kids, sometimes I have to go back and apologize. I'm like, why did I even yell at you? Was it even that serious for me to yell at you instead of talking calmly and hearing you? Because my boys will tell me like, you're being mean. And some of the students sometimes will be like, Tianis, you're being rude today. And I'm like, oh, okay, let me check it. Thanks for telling me that.
Yeah.
I always tell them, like, let me know if I am mean to you. Let me know, I want to be that safe person. But it's definitely, I feel like the way that the world perceives youth and how they're treated, they just are not given that opportunity to say that there actually is something wrong with you. And then when it comes back to sexuality, it definitely sucks because in the Black household, there is definitely not like you're gay when you're 10. It's you're just being weird. Stop doing that and wait till you're gay when you're older. Like as far as when I see, white children, when they're like, no, this is me. This is me. Their parents may have some pushback, but they let them be them. And then they fight for them to be in those spaces like school. And if a boy really believes that he's a girl, like then white parents are like, boom, 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 boom. They're on it. And like, no, they don't want to use the male bathroom. As far as Black parents, it's like, no, you're using the male bathroom. So we're also like beating our kids down. And then we're not helping them how we want the community to help them. So I just think also having them have that safe space, because when we do there is a large amount of parents who do support their kids and they go to bat for their kids a lot. But it's like, what can we do to show our kids that we're done with letting people just pull you down? But then if I get upset, then I'm showing people are like, you really want your child to act like that? You want your child to act like you? So it's like, what do we do as adults? And then how can we show our youth that there's that appropriate space when you're mentally broken? And I feel like a lot of us as adults are mentally broken ourselves. And so we don't know how to repair the youth in our community. So it's like just an all around circle when I just look at the school setting, the outside setting, the home setting. It's a lot of broken things that need to be repaired, but the community of color is left out of so many spaces that it's going to take a lot to repair it, but it needs to start with one thing, and that's being inclusive in those spaces that they're still shying away from us even putting our kids in certain things. Our kids are going to feel uncomfortable. So it's like, it's a catch-22.
Yeah. Well, all of that, you have my mind racing in a lot of different directions because you had so much important content to share, both of you, in that space. And what it creates for me is just like a general recognition of how much complicated territory young kids of color are having to navigate right now. And as, a middle-aged white lady in a space that doesn't have to navigate, and my kids don't have to navigate it in that way, but thinking about how we want to be supportive and build a system that can be responsive, what's the answer? How do we do this together? How do we make sure that the challenges that each of you are talking about and working to address and support, and the system work that we're doing here at Speak Our Minds, how do we do this well in a way that allows these kids and these communities to have a voice that's meaningful and leads to important system changes. And what are some of those system changes that we need to start seeing quickly? So either of you can start.
Yeah, I would say like having that inclusive space. Like, what does that look like? When we look at some of those groups that they have, they're like, oh, this is a support group for whether it's mental health, sexuality, really pushing to earn the trust of the Black community. And that comes along with finding people who actually are in the work, like doing the work with their heart and not doing their work with the paycheck. Because I find a lot of that. There's a lot of that's right now that's lacking with a lot of organizations, a lot of the hospitals when they're providing these services. They need to be in it, like with their heart, and then having them at the table, having people of color at the table, having youth at the table. What are they wanting? Are we really even listening to them? Mm-hmm. And we need to listen and not try to be their savior, because nobody wants a savior. I want you to listen to me, and then I want you to hear me, and then provide those things that I say that we need. And don't provide them trying to be a savior. Provide them in a place that's coming from your heart, in a place that's going to do good, and not just because we can recognize that a lot of our kids can call BS on a lot of things. Yep. Automatically, they'll step into a space and be like, no, I'm out. This is dumb. Mm-hmm. And so it's creating that inclusivity and actually having them at the table. And when we're creating the policies and creating those changes, where are the people of color? Because you're thinking that you're doing something of good, but it's like, are you really doing something that's good for them?
It's kind of, just to piggyback on Tiandis, it's kind of like the idea of creating a program for a population that you didn't include. And you're saying, this is what I know that they need. And then you're on a totally different page than the community without allowing them to be involved and having, like Tianda said, having a seat at the table. I also think it's important I know that back in the day, we really didn't talk about mental health. I think making it a thing, right? And there's still, don't get me wrong, there's still stigma around mental health. And I do see and recognize that youth that I speak to, some of them aren't afraid that they have a therapist and they're able to talk to someone. Mm-hmm. But again, access to mental health services, the long wait time of months just to get in and be seen, talking to youth around how do we address the issues of getting in to meet with a therapist, or how do we even recognize that this feeling that I have inside of me is anxiety, or what's making me anxious, like educating youth around the definition of mental health and what is mental health. And we all know how we keep our bodies, our physical health together, drinking water, eating fruits and vegetables, and staying away from the sugars. We know, and getting rest and sleeping 8 hours, right? We know how to take care of our physical health, but what are ways that we take care of our mental health? What is self-care? What does it look like to treat yourself as self-care? Just getting your hair and nails done, or eyebrows or eyelashes done. That's stuff that we like to do, but is that really self-care? Are we practicing meditation? Are we practicing breathing? How are we coping with our realities? I love to let youth know that whatever situation that they're in today doesn't dictate what they will be in the future as adults, right? But you either go away from where you came from or you go to what you came from. And so those cycles of generational curses and things that we tend to have, and sometimes we have to unlearn behaviors that we were taught growing up, right? And so all of those things are so important. And just to include what Tiandis had said about inclusivity, it's so important to be included. I find myself still as a Black woman going into spaces where I am the only Black woman in the room. And it's always educating young people of color of, hey, not all the time are you going to be invited. Or when you are invited, let your light shine, be who you are, and speak up for yourself. And I also teach teens how to advocate for themselves, because that's also so important.
And it's true. It's true. Sorry, Tiandis, what were you going to say?
No, I was going to say it's definitely true. It's for sure true. Like you have to teach the youth. Like when you walk into the room, there may not be anyone that looks like you. But, once we get into that room, we're like, when we see somebody, we give there's like a universal nod that we do.
Mm-hmm.
There's like a universal nod and like a confidence that comes over. You just give each other like the look, whether they're, Black or they're Latino, you just look and you're like, oh yeah, okay, we're good. We're good.
Yeah, because it's important to feel like you have an experience in common with someone, that they're going to understand where you're coming from. Well, when you think about like what you're saying about all of that, I mean, if I'm sitting in the seat of the team at Medicaid right now, which has a very hard job of building a different and better approach to providing youth mental health care, if you take all of the things that you just shared, and if you were to say to our friends at Medicaid, you have to start here for this to work for our youth of color, what would you tell them? Like, where do they need to start? What is the thing, or where are the places, or what are the things they need to be doing for these kids to get what they need from Medicaid when it comes to their youth mental health care?
I think I would definitely say, start with actually providing the care. Like we're tired of resources because the resources lead to one place and that resource leads to another place. Let's start providing actual care. Like spend those dollars, pay these therapists or pay people who have this experience to actually provide the care. Kids should not have to jump through hoops to get the care that they need. And no one is above anybody. So just because their anxiety or their bipolar or their undiagnosed depression is not as severe as someone else's, they haven't been seen since they were 6, you don't know what they have. Like, let's start providing care because that's what's really going to drive our youth to actually seek out the services. We're constantly handed a paper of, oh, go here. Then we go there. We're constantly handed another paper. The cycle has to end of constant resources with no action.
Mm-hmm. What about you, Q? What would you say?
Wow, Tiandis. I'm behind that. I think the biggest needs around just increasing access, right? And ensuring that services are culturally responsive and trauma informed, and also hiring Black and brown staff that looks like youth of color.
Yep.
And I don't want to get started and go on a rant about pay, but
you can go for it. That's what this is for.
The pay,
those reimbursements.
yes, to pay what are worth, right? Yep. To make us want to apply for those positions for that marginalized community that we have. And it's so important, like I said, increasing the number of providers and not being so judgmental of the population and the population of youth of color, right? Because they're facing so many intersectionalities, right?
Yep.
And it's so big and we don't even realize how that is affecting their mental health.
Right.
And so I think sharing statistics with, the Medicaid people to let them know the statistics of mental health in youth of Black and brown young adults or adolescents.
Yep.
Right. And I think talking about behaviors versus IEPs, right?
Yep.
IEP isn't a behavior, right? It's a learning disability, right? And knowing the difference between the two, right? And just because Black and brown students act different doesn't mean, and they have a behavior concern, how do we work through those things, right? Yeah. Opposed to just, I don't want to say it, but I'm going to say it, passing them to the next grade, right? Yep. And having that paper trail carry them throughout their whole elementary, secondary, post-secondary, right? Throughout their whole lives.
Right.
And it's just so many things that I'm kind of tapping into. But again, just circling around, it's so important to show data, right?
Right. Yep.
I know that therapists are probably understaffed, or there's just not a lot of people of color that are in this field, or they're getting started with businesses. We need to contract and hire them to be able to fulfill the gap between getting services for mental health issues and concerns.
Yes. Well, all of that. Yes. So to both of you, I mean, I could keep doing this for days and days on end, and you have so much incredible insight and information that I hope you'll both come back. We're really just at the start of this journey as a state in creating a new and better system of youth mental health care for kids in Medicaid. And there are going to be a number of different ways in which we'll need you and your networks to be at the table, making sure that this gets done correctly. So I hope you'll come back. I can't thank you both enough for being here, and we'll make sure that information about how people can find you, how people can find you to work with you, we'll make sure that all that's available, because I think you're going to be in high demand after people hear what you have to say. So Quatisha and Tiandis, thank you so much for being with us today, and we can't wait to have you back.
Thanks for having me.
Thank you, Heidi.
This conversation is definitely needed, and I'm glad, I built a relationship with you. I met both of you guys at Children's, which is crazy. And now we're all friends like 7 years later. So I am grateful, for the friendship that we have and the professional growth that we all continue to push for when it comes to this type of space.
I agree. Long live friendship.
Yes. And I just want to say thank you for this opportunity. And also look where we are today, right?
Right.
Starting our own businesses, doing our own thing, and still have that common goal of our community.
That's right.
And so that's so important. And again, I just appreciate you actually having this as a topic for Speak Our Minds with youth of color.
Well, we're just getting started. So don't worry. We're going to be bringing you back, because you're right. It's like, if you only talk about it once, it's just like not even scratching the surface.
Yes, I agree.
Thank you both.
Thank you.
Thanks.
Thank you for joining us on this episode of Speak Our Minds, the fight for youth mental health. We hope you found today's discussion insightful and inspiring. The journey to transform Colorado's youth mental health system is far from over, and your engagement and support are crucial in sustaining this momentum. If you have any questions, comments, or stories you'd like to share, we'd love to hear from you. Connect with us on social media or visit our website at www.speakourminds.org for more resources and information on how you can get involved. Don't forget to subscribe to the podcast on your favorite platform so you never miss an episode. Together, we can make a difference and ensure that every young person in Colorado has access to the mental health care they need and deserve. Until next time, stay informed, stay engaged, and keep advocating for a brighter future. The Fight for Youth Mental Health with your host, Heidi Baskfield. Thank you for listening.